Hey guys! Yes, so I'm here to tell you about reasons why you should see a reproductive biologist or a gynecologist. Yes, because sometimes people wait for when they are married to see a gynecologist or a reproductive specialist or a biologist. But I'm here to tell you that you might be watching and you have a reason to see one, but you just have not realized that yet. So, why should you see a reproductive biologist? One, if you're a young lady and you're having heavy periods that you cannot even explain, that you could use up to 5 to 7 pads a day. Yes, that's a lot. So you need to see a reproductive biologist or a gynecologist. If you're also having periods that you also have a lot of heavy clots coming out, yes, this could be that there's some underlying condition that you're dealing with that you're just not yet aware of. So you should see a reproductive specialist. If you're over 35 years and you just got married and you've been trying to conceive for about 6 months and you're not achieving conception, you should see a reproductive biologist. Gone are the days you wait for a year. Yes, once you're over 35 and you've not achieved conception over 6 months, you should see one. And then also, if you're a young couple married for over a year trying to conceive and not achieving conception, you should see a reproductive biologist or a gynecologist. Yes, if you're also an AS person and you have a partner that is an AS person, it's high time you saw a reproductive biologist so you know what your chances are and also have a good understanding of what you intend to do or what you intend to carry on with. Also, if you've noticed that you have breast discharge, you're not breastfeeding, you're not pregnant, and you noticed you're having some discharge from the breast, you should see a reproductive biologist. If you're menopausal and you're having abnormal bleeding, yes, you've not seen your period for like a year or two and suddenly you just started bleeding unexplained, you should see a reproductive biologist. If you're having recurrent miscarriage, it's high time you saw one, because you might not really know what's going on. You might just think they are just miscarriages happening, but something could be wrong. So it's good that you see a reproductive biologist. Yes, if you're a young lady and you're having irregular periods, maybe you see a period now and the next time you're seeing it in 6 months, that's not normal. Yes, it's beyond the normal, it's outside the normal. So it's good that you see a reproductive biologist. If you're having painful sexual intercourse and you're still young, not like you've even gotten into menopause, yes, there should be something wrong. There should be a reason for that pain. So it's good that you see a reproductive biologist to find out what's going on so it could be dealt with. Also, if you have very painful menstrual periods, yes, some people have menstrual period and menstrual pain and everything might seem fine, but there are some that are very excruciating pains. Something might just be wrong. So it's good that you see a gynecologist or a reproductive specialist, a reproductive biologist at that. Yes, and then are you in this category that you've noticed that you have family history of struggling to conceive and you're just a young lady, you've not even married yet? There might just be something that is not yet discovered. So it's good that you see a reproductive biologist just in case there's something that is missing out that could be dealt with. So this is the much we can do for now.